The Fluency Rating Scale. This training was developed by Dr. Ryan Pollard in collaboration with the Colorado Department of Education to assist school-based speech-language pathologists, administrators, and others who are wanting more information on how to use and score the Fluency Rating Scale. Several changes were made to the Fluency Rating Scale. To begin with, the title was changed to Fluency to include stuttering, cluttering, and other speech-related disorders. Clearer guidance is provided on measuring and describing behaviors that are apparent to the listener. These are termed overt behaviors. These can include disfluencies, some types of secondary behaviors, and cluttering symptoms related to speech rate and intelligibility. Next, behaviors that are not observable to the listener are now covered in a new section. These are termed covert behaviors. These can include secondary behaviors like avoidances, negative feelings and attitudes related to the disfluency, and negative reactions of peers. Lastly, the new scale includes a section on risk factors for preschool-age children. When performing a comprehensive fluency assessment, there are several standardized instruments from which to choose. At present, there are 2 commercially available normative instruments that measure overt stuttering features and 2 that measure covert stuttering features. These are the Stuttering Severity Instrument, the SSI-4, and the Test of Childhood Stuttering for overt features, and the OASIS and Behavioral Assessment Battery for school-age children who stutter for the covert features. If you complete a normative assessment for both the overt and the covert behaviors, score the normative assessment component on the rating scale for the assessment which indicates the most difficulty. For example, if the normative assessment for overt and covert behaviors are typical, then the score would be 1. If, however, the score for overt behaviors is typical and the score for covert behaviors is between 1.5 and 2 standard deviations from the mean, the score for this component would then be 3. There are currently no normative instruments for cluttering, so the scoring SLP will need to perform an informal assessment through language samples and use the observational assessment section to score behaviors when determining cluttering. The text on this slide is included in the narrative of the rating scales in the fluency section to provide further instructions on scoring standardized assessments when using a normative instrument that does not provide standard scores with a mean of 100 and a standard deviation of 15. The OASIS is used as an example to demonstrate. For example, a student could score 0.8 standard deviations above the mean, which ordinarily would equate to a score of 1 on the rating scale. However, for this particular instrument, such a score is in the moderate to severe range, so it would instead equate to a score of a 3 or 4 on the rating scale. When this happens, use guidance from the assessment manual to determine the appropriate rating. When scoring the observational assessment of overt behaviors, the frequency, duration, and observable secondaries data can be taken from speech samples collected with a normative severity instrument, as well as from informal speech samples or observations over multiple days and settings. Average duration of disfluency should be calculated from the 3 longest disfluencies within the speech sample or observation. For students being assessed for cluttering, the scoring SLP will judge whether the rate or flow of speech is perceived as too fast or irregular, and to what degree it impacts intelligibility. Calculating words or syllables per minute can help with this judgment, but it's not required for diagnosing cluttering, as the rate component of cluttering is perceptually based. Misarticulations, such as distorted sounds or omitting phonemes or syllables, can also impact speech clarity in stuttering, and can therefore affect the scoring SLP's judgment of intelligibility. When scoring this section, check all the characteristics that apply, then score the last column with a check mark. For example, if a student has moderate disfluencies, frequency of disfluency is 7%, and the student's flow of speech is perceived to moderately impact comprehensibility, but there are no or minimal observable communication avoidance behaviors or secondary behaviors, the score would be a 3 for this component, since it's the highest column with a check mark. Here are some assessment strategies for cluttering. If you're assessing a student for fluency, you'll want to evaluate for both stuttering and cluttering. If you use the observational assessment only scoring option, be sure to include a statement in the IEP indicating why you have made this choice. When assessing speech samples for cluttering, look for rapid or irregular rate, fluent flow of speech, or jerky flow with abrupt pausing or ending of sentences. Consider intelligibility or comprehensibility of the sample and assess phrasing and prosody. The speech sample should include rote tasks in fast, regular, and slow rate. Comparisons of speech characteristics should be made between reading, conversation, and a discussion around an academic topic. As time goes by, children who stutter can develop symptoms that are not always readily apparent to the listener. These covert features can be equally or more impactful compared to the observable disfluencies and physical secondaries associated with the disorder. Data on covert features can be obtained from normative instruments that assess impact, as well as through other non-standardized means, such as checklists, questionnaires, student interview, and parent or teacher interview. Note that some of these features can also apply to students who clutter. For instance, feeling frustrated about one's speech or having others comment negatively on one's speech could also be characteristics of cluttering. If a student is 6 years or older, make sure to include evidence from the student's self-report. To score this component, you'll want to score the column with the most checks. The features are all the same in each column and are scored based on the frequency in which they occur. For example, avoids or experiences anxiety around speaking is a feature in each column. If it occurs often, then it would be checked in the third column. If the student only sometimes avoids a particular sound or word, then the second column would be checked. In this student's profile, he also reported that he's often embarrassed or frustrated about his speech, but is only sometimes teased about his speech. For this component, we would score the highest column with the most checks. Since both column 2 and column 3 have 2 marks, we would score the highest column, which would be column 3. Although common covert features such as avoidances or negative feelings may not yet be present in preschool-aged children who stutter, intervention should be considered when several risk factors are present. These factors can help predict chronicity and guide the SLP in determining if and when treatment is warranted. The risk factors listed in the rating scale are the most useful for prognosis and should be considered along with the other components in this rating scale. When scoring this component, mark all the boxes that apply and score the column with the most checked. For example, if all the boxes in column 2 were checked, this would put the score as 4, since all 3 of these elements are present in column 4 and would then meet the criteria of 3 or more being checked. You will collect much of the data on adverse effect from informal measures, observations, along with self-report instruments, questionnaires, and interviews. Adverse effect from stuttering or cluttering is typically seen in participation restrictions and activity limitations, as well as in personal and environmental contexts. Participation restrictions could include being ostracized by peers or refraining from talking in class, for example. Activity limitations could include struggling to read out loud, for instance. Personal context may include feeling anxious or frustrated about one's ability to speak, while environmental context may relate to being teased or bullied because of disfluent speech. A student's academic performance, for example grades, may or may not be affected by these factors. When choosing a score, be sure to use evidence from your formal and informal assessments and self-report instruments to support your decision. Adverse effect is an area that is somewhat subjective and left up to professional judgment, guided by the evidence gathered. These are some guiding questions to assist the team. Asking teachers open-ended questions allows them to expound on the answer and to provide student-specific examples. Even if you use checklists, follow up by asking how the student demonstrates the skill. It is always important to compare the student to peers from similar cultural and linguistic backgrounds. Tie the skill or deficit back to what the grade level expectations are to assist in determining whether or not speech and language services are needed for the student to access general education. These are some examples of statements you may hear from parents or teachers that can be used to assist the team in determining the impact of the student's fluency on access to general education. To arrive at a rating, total each component to obtain a total score. The rating is determined by the category in which the total score falls. For example, if standardized assessments were used, then you would score the comprehensive fluency assessment section to arrive at the rating. If the total score is 14, the rating would be 3 or moderate. If no standardized assessments were used because they were not appropriate due to cognitive, cultural, or linguistic reasons, then use the observational assessment only section to achieve a rating. If the total score is 14, then the rating would be 4 or severe. Thank you for listening to this webinar. If you have questions about this rating scale that are not addressed, please click the link below this posting on the web page to submit your questions. Webinars will be scheduled to address submitted questions.